All right, good afternoon. My name is Kevin Coughlin, and I'm from the Department of Health Services. And in partnership with University of Wisconsin Green Bay, we're going to be talking today about our WISC Caregiver Careers, which is a great program for our certified direct care professionals. And my colleague here, I'll let her introduce herself.
Hello, my name is Casey Kapelzinski. I'm a program specialist at UW Green Bay on the academic partner side of the program. So Kevin and I will tell you all about the exciting work we've been doing since we were here last year.
Yeah, so we're really excited to be back again. We just love this conference. There's just so much good energy and a lot of people making differences in people's lives. So we're honored to be here today. And the WISC Caregiver Career Program is funded by, let's see, my little thing's not working, right?
Oh.
All right, we'll do this. Oh, and that's not advancing either. Let's see.
Ta-da, that's what we have. While we do this, show of hands before you came, how many of you had heard about this program? Excellent, okay. That's pretty good. There we go.
Okay, no problem.
Thank you.
Yeah, so WISC Caregiver Careers, we're using American Rescue Plan Act funding from the federal government, and money follows the person. So we're kind of combining some of that money that was given to help really recover from COVID, and a lot of our programs, kind of suffered from that pandemic. So we're using that funding really to build the infrastructure of a whole new program, and we're calling this WISC Caregiver Careers. So today we're going to just talk a little bit about the background on kind of where this program came from, talk about our both the training program that we have, but also the job matching platform to help people find good caregivers. And then we're going to talk a little bit about what we've done since last year. So we were here last year at this time, which was only a couple months from the date that we launched the program. So we were really early in the development of it. So a year later, we have a lot of updates that we want to share, including language access, micro-credentials. So with that, just again, our introductions. This is our information if you want to get a hold of any of us, and you should have access to these PowerPoint slides. So feel free to email us and we'll answer any questions you have. So, we are really experiencing a crisis with our caregiver program. Some of you may be experiencing it, firsthand. So, the statistics aren't good. 1 in 4 positions are vacant of people looking for caregivers. And then also our turnover in this field is very high, up to 50%. So really we're trying to, we did a lot of research. We started with, CMS had a 8-month-long program with all the states in the nation to look at all the different things that we should look at when we're trying to address this crisis. So we're following a lot of their recommendations. PHI is a national organization that helps states, and we contracted with them to really help guide us because they're national experts. And then we did our own research. We had listening sessions across the state where we heard from caregivers and we heard from people that serve on boards and councils and people who are self-advocating and providers. And we heard, what's important to have in this kind of a training, this important training material. So we heard from a lot of people, and then we, as the department, partnered with the University of Wisconsin Green Bay because they are really academic leaders. They do this work all the time, and they are really the people that did most of the work in developing this great curriculum that we have. So what we wanted to do is kind of our goals and objectives is to increase competencies. It was kind of the Wild West of training out there. I mean, people were just doing any kind of training that they could. The regulations said you have to meet the needs of the participant, which isn't very clear. What does that mean? So we wanted to standardize it and really raise competencies across the board. And we also heard from caregivers that they wanted career advancement. It was important to a lot of people. How do we build their careers and help them stay in healthcare and advance if that was something that they were interested in? And we have to get new and more caregivers, and we're going to talk a little bit about the marketing that we're doing to really encourage more people to get into this field. And then we want to help those who self-direct. You know, it's really important that our employers, our self-direction individuals have the access to these resources, that have good staff that can take care of them. So we're intentional about improving that. And then just sustainability. We don't want to just, you know, we have some really good funding with the American Rescue Plan Act, but when that goes away, what do we do? So we wanted to really build a program that's going to be sustainable into the future. So I want to show this quick video that I think really has a summary of all the things that we're hoping to achieve with this program.
WIS Caregiver Careers, a free certification program to increase the number of caregivers in our state.
Direct care workforce professionals are so important in our state because they are the backbone of what is supporting our home and community-based system.
So if you need support with regular activities of daily living, if you need support with cooking, if you need support with bathing, these are things that we can bring to you in your home with the support of direct care professionals.
80% of the individuals now live in the community versus in an institutional setting. We are one of the few states in the nation that has accomplished that goal. It is a much more cost-effective option for people. It's what people want in the future.
The demand for this workforce has ballooned in the last few years, and it will continue to surge in the decade ahead. We estimate that between 2020 and 2030, the long-term care sector nationally will need to fill about 7.9 million job openings in direct care.
WIS Caregiver Careers really benefits the people of Wisconsin. Direct care professionals do so much to support the health and well-being of people all over the state so that they can live as independently as possible in their home or in a community-based setting for as long as possible.
Wisconsin's program is easily one of the best in the country because of a few reasons. One is that it's building on a really successful training and recruitment model. It's really a building block towards the ultimate goal, which is making sure that direct care jobs are a true profession that are respected as much as any other healthcare role.
The Wisconsin Department of Health Services has partnered with the University of Wisconsin at Green Bay to create a direct care professional certification program. And so this program will help provide training in a set of 14 discrete skill areas that a direct care professional needs in order to take care of someone in their home or in a community setting.
We know that by being able to provide this online, we can reach the population of the state and help to make a bigger impact on the problem we're trying to solve. Everyone deserves that comfort to know that the person that they are hiring has the proper training and expertise before they do the job. And we want to make sure that everyone has the most up-to-date knowledge and credential to be able to make sure that they're providing the best care possible.
It's our goal to be able to train and certify over 10,000 direct care professionals across the state. You have the opportunity to take the training for free, to receive a $500 bonus as you are hired into your first job.
But what we're also doing is linking that training to other certifications such as Certified Nursing Assistant.
For the future of work, it is really important for people to be able to have recognized credentials that they can use to help advance their careers. Credentialing is really important to allow people to be able to create their own career pathways.
We believe these certifications will show that this workforce is worth an investment that is greater than the one that is being made now. It will attract more people to the work, and that will sustain these community services that Wisconsin has led the way in creating since the 70s.
I think the training programs ensure that workers have the knowledge, the skills, and the confidence to succeed in their roles. And I think the combination of those factors is cutting edge, and it's among the top in the country.
WIS Caregiver Careers is a professional workforce advancement program of the Wisconsin Department of Health Services in partnership with the University of Wisconsin-Green Bay. Visit our website at wiscaregivercdcp.com.
Yeah, so a couple of those people you may have seen in the conference today. Patty Becker, she's here today, and then Jenny, the woman in the wheelchair, she was here as well today at this conference. So it's great to see, some of our Wisconsin people. They're not actors; they're kind of real people. So part of what we're doing is we're trying to recruit 10,000 people while we have this funding program to become certified direct care professionals. And whether they're working currently or new people coming on, we want kind of to standardize this training across the board. And what we're doing is we're using this funding to help incentivize those caregivers as well. So if an individual wants to have one of their caregivers take this training, they can get once they're complete the training and they're working for you, we validate that, they would get a $250 bonus. And then if they stay with you, or if we're talking about a provider for 6 months, they would get another $250. And what's really nice about that is it comes to that caregiver directly in the mail. It doesn't have to be given to the employer first. So they go to their mailbox and they get that nice check for completing that training and working for one of our individuals in either IRIS or family care program. So also, why did it jumped back. Huh. Oh, we only have 9.
It does.
Yes.
So CLTS, IRIS, and family care, yes. Using MAP as their Medicaid program? Oh, MAPC. Yep, so we are really focused on those HCBS providers. So we did not close this training off to anyone who is a caregiver. So anyone who is caring for someone right now can take this training for free because the education is needed. The bonuses specifically are tied to those HCBS programs. So is he enrolled in family care, IRIS, either of those programs? He's just got Medicaid card services. So it's specifically tied to those HCBS programs. The incentives are, the training is available to you to take to learn. Yes, the free training is available to you. Right, it's tied, the bonus is specifically tied because of the funding to those HCBS programs, family care, IRIS, children's long-term care services. Right. Right, so it's specifically tied to him being enrolled in one of those programs. Right, the bonus piece wouldn't, but the training is available. Absolutely for free. There's no practical piece at this point. It's just the actual online learning course, which I'll talk about shortly.
Okay, but he could enroll.
Yeah, and if you were caring for him, you would be eligible for the bonus. No, no. Yep, he can enroll at any time, and if you are a caregiver and we can verify that you are a certified direct care professional, say you completed it beforehand, you would get that $250 once he is connected to that HCBS program. So that is applicable. That's why we didn't want to close the training off to people who are providing care for those not enrolled in programs, because we know that eventually many people do end up enrolling in a program. And if they have these caregivers that have this certification, we want them to still get the bonus once the person is enrolled in the HCBS program. Does that make sense? So it's not closed off. If you stay with the same, you have to stay with the same employer.
We're not going to have the full screen. For some reason, it's not allowing us to
Oh,
go there.
okay.
So you're on.
Okay, so this, oh, yep.
On his, what about those that roll into CCS, which is for the mental health side rather than physical? Would that apply as well?
Same Yeah, so same thing, they'd be able to take free training, but not the bonuses.
But not the bonuses. So HCBS is that line cut off for bonuses. Yep,
Yep.
yep, yes.
So, if my caregiver has been working with me for a very long time, do you get this training or do you have to be a new?
That's a wonderful question. Nope, we did not close it off. We do not want to not give training to existing employees. One, because we know there's always new skills they can learn. So if you have someone who's been with you long term, they're absolutely eligible to take the training.
But is the bonus applicable to them?
Are you
Yes.
enrolled in an HCBS program? Yes, then yes it is. Yes. Yes, we're going to talk about, we are going to talk about that in depth in a few slides. So yes, we do. All right, so this is probably not a surprise to anybody here. Did you have a question?
Yeah, I was just wondering how close to the 10,000 are you?
We're going to talk about those numbers too. Yep, we'll talk about all of that. Those are all wonderful questions. You guys are anticipating everything we're gonna put in. Yes.
I'm actually enrolled in the course,
Yep.
but I haven't started.
Yep, we spoke yesterday. Yep, so you can get started at any point.
Do I have to start before the 10,000 is up?
Well, right now you want to go ahead and talk about the
Yeah,
funding?
so our funding goes through, well, right now, it's going to go through March of 2026. We are trying to get it in the next biennial budget, which will allow us to go through the next 2 years. And then, because I think this is such a successful program, we're hoping this is just long-term, that we'll
Yep.
continue to be able to do the program. So,
All right, so we support in Wisconsin alone over 100,000 people in the community who are not in institutions. So they don't have to live in an institution. So our certified direct care professionals that complete our program, there's a variety of places that they can work or may already be working if they're already a caregiver for you. So that includes non-medical home care, IRIS one-on-one care, adult family homes, CBRFs, RCACs, which is a residential care apartment complex, family care, self-directed services, all of those apply, and settings are continuing to expand as the needs expand, and every single one of those settings is going to need caregivers. All right, so most importantly, our course is free. That is, I think, the first thing to talk about is that it is free to people in the state of Wisconsin. It was very important to us at GB and DHS to make this as accessible as possible. Adding into that accessibility piece, the course is held completely online because we needed it to be available statewide. We knew that if we had to find instructors in a regional capacity, it would have really limited us to who could take this course. It would have limited the ability for the caregivers to get to the place they have to take the course, and we didn't want to do that. I know that there are some mixed feelings about online learning, and I have them myself, but I think what we've learned through the pandemic especially is how to really kind of perfect some of that learning. We were already doing it at UW Green Bay. Many institutions have been for a long time. I've been out of college a long time, and I did some online classes. So it has come a very long way. The technology has come a really long way. So we were really kind of trying to figure out how to make it most accessible. I'll take your question in just one moment. And that was to keep it online. So it is also self-paced. We recognize that caregivers have extremely busy lives. They have things going on. Many of them are taking it outside of work hours if they are already employed. And so we wanted to give them the opportunity to be able to start and stop as they needed, as life worked around them. So it is approximately 30 hours of training. On average, people are taking about 70-ish days to complete it. We just ran this data, so it's really fresh in my head with the people that have completed the course. And we utilize our learning management system through UW Green Bay, which is called Canvas. So some of you may have worked with learning management systems. Blackboard is another one. Canvas is the one that we utilize, and our students get access to that learning management system. And one thing that's been really nice is many of our students that are enrolling have no experience with anything after high school. You know, maybe they have a GED or a high school diploma. We really wanted to break down kind of some of that mystification of pursuing higher education too, and let them know that they can do it. You know, if you've never had any sort of college class, it can feel really intimidating to try to figure out your learning management system and keeping up with that. And that was a really important thing for us. So people take this 30-hour training, and then we offer, because we were trying to mirror the CNA program and really elevate it from a professional perspective, they have to take a comprehensive assessment that applies to everything that they've learned, and they have to pass with a 70% or better, which mirrors the CNA program. So we actually proctor that live on Zoom I know is mutually exclusive, but we have somebody available. And as an institution, we will accommodate any need. That can be removing the 2-hour time limit. That can be an individual session if you're concerned about having other people in the room. Perhaps we've had students need someone in the room to read them the questions out loud. All of those accommodations are available, and bless you. And when someone signs up, we do ask if they need any accommodations so they can personally work with us to get those taken care of. And we also will renew this every 3 years, and we have 3 different options that I'll talk about as we kind of move through. But the course is 30 hours and 14 competencies that I will talk about, I believe, on the next slide. Yes, okay. So part of those 14 competencies is to go through things like communication, things that you don't come off the street knowing. What is self-determination? What is autonomy? What is dignity of risk? How, as a caregiver, do you fit into these very nuanced concepts that you're not going to learn on the fly? And we don't have time to teach, right? Those all come with a lot of experience working with people, and each individual has a different relationship to those concepts. And so another piece of what was really important to us and was important to our certified direct care professionals that we talked to in our focus groups was raising and elevating this to a profession. This is not a job. This is many people's career. This is their profession, and it should be treated and respected as such. And so a big part of that was figuring out in how many different ways we could do that. And one of the ways was to utilize what UW Green Bay does for many of our certificate programs, which are digital badges. So these badges are essentially an online representation of your competency in a certain area. So you can attach that to your resume, to your email signature, to your LinkedIn profile. And it is particularly fun when we have a CDCP email us and it's in their email signature. I get a little jolt of happiness every time that happens. I've also seen it on their resumes. And it's just a way for someone who is looking for a caregiver to click, and there's what we call metadata inside that says this person has completed this program, they have met these competencies. It's a really nice visual representation of what they're doing. And that we've seen that kind of become a growing thing in higher education, and so we wanted to implement that into our CDCP program as well. Okay, so we talked about training, which is a very huge part of this. The other piece is the workforce development and sustainability. So obviously we need current caregivers to have increased competency, but we also need new caregivers, right? Like that, the numbers are startling in many cases. Excuse me. UW Green Bay is lucky to have access to a job matching platform called Handshake. So some of you may have utilized that before or have experience with that from other jobs. And we worked directly with Handshake to figure out how we could put some parameters on the employer profile and the student profile that work through our CDCP program so that other facilities like a hospital or a nursing home can't come in and snatch up someone who's taken this training, right? That was something that employers in our focus groups were very concerned about, because we do have a registry that you have to have someone's name to search. But if you know this person's name, it's real easy to go in and find out. And employers were concerned about people being poached away from them because we already don't have enough people, right? And so we really got innovative with the Handshake piece to create this little pocket within it to kind of hide them from external employers, but keep them connected inside the program. And you can do a myriad of things in Handshake. You can, if you are someone searching for caregivers, you can do job postings. The people who have completed the caregiver training but are not yet employed, they can search for jobs with employers who are connected to our program. So knowing that when they become employed, they're eligible for the bonus because those caregivers are connected. Yes? Yeah, so we were talking about that. So it would have to be connected for the bonus part to an HCBS program like IRIS, Family Care, Children's Long-Term Care Services. But your caregivers, if you're just going through your card services, can still take the training. They just wouldn't be eligible to receive the bonus because of the way the funding works.
You'd have to sign up for IRIS in order.
IRIS or Family Care. So you'd have to be, you as the person being, if he's caring for you, would have to be enrolled in one of those programs for the bonus, but the training is still available.
We still take the competency annual.
Yep, you can still keep up your certification.
How is that my annual compliance training linked with this?
It does not, this is totally separate. So,
Okay.
yep,
So I take this course separately, I just completed it always at his agency. And then, of course, they do have paid annual compliance training, do whatever internally I'm doing,
yep.
and then do this separately. I'm signed up, but I haven't started it yet. Is there any limit for me to start?
Well, again, we talked about it's really right now tied to when the funding
The only reason I
goes
say
through.
that is because I'm busy with the MATC,
Absolutely.
Blackboard, that's R, not Canvas.
Yeah, your LMS, sure.
And I have to give attention to my coding final project exam.
Yeah, absolutely.
After whatever, early part of December, I'll be free to start.
Yeah, that's still within our time frame, as Kevin said, May 2026 is what, or March 2026 is when we're looking at. So that's kind of that time frame to keep in your mind right now. Those are all great questions. So you can look at candidate profiles if you're trying to hire caregivers who've been through the program. There's auto job matching settings that we can help you set up so you get an alert when someone in your area is now available. You can email each other within the system so you don't have to do it externally. You can set up interviews with the caregivers through that system. So there's really a lot of possibilities that we are able to do within Handshake, and we call it the WISC Caregiver Connections powered by Handshake to rebrand it that way.
So I think we're going to come back to demo at the
Yes,
end.
yep,
So-
if we have enough time, yep.
Yep.
All right, so Kevin had said, we were here last year just about 2 months after we started the program, so we were right in the thick of things, and we have been very, very busy. So just a quick overview of some of the things we're going to tell you about. Our new CDCP and teacher referral programs, our work with Wisconsin high schools and the Department of Public Instruction, our expanded language access, which was asked about, our micro-credentialing program, our updated marketing, and our updated data. So we're going to kind of go through all of these things as we move forward. All right, so since we launched, we've added 2 really exciting referral incentive programs. So we were showing that many of the people coming to the program were being referred by people that already completed it, because caregivers have networks, right? That's how they're finding their jobs. They're often connected to, they might all care for the same person sometimes, you know? And so we wanted to incentivize the people that were drawing those people to our program. And so we were able to fund for a certified direct care professional who's completed the program successfully. If they refer a friend, family member, whomever, and that person completes the program successfully, that's a $250 bonus paid on top of their $500 for the referral. I'm just going to take a sip of water. Give me 1 second.
And no limits on those
Right.
referrals. So if you have 10 friends and all 10 of them complete the certified direct care professional, you would get $2,500. So that it's a great incentive to get more people. And, I think what we find too is, good caregivers have good friends that are caregivers, and
Yep.
it's just going to be a quality program if we can, kind of help get everybody involved.
Absolutely. And so on top of that one, which is a very exciting incentive for these CDCPs, is our teacher referral. And I'm going to talk about how we're working with the high schools. But one thing we were really passionate about was connecting with those high school students, because they're just kind of getting their feet wet, right? They're not even sure if this is something they want to pursue, if they want to go to school after high school, maybe they want to go right into the workforce. It's a free training that gives them access to that, and then they can get the bonus if they get hired. And so if a teacher refers a student and that student successfully completes, we pay $250 to the school district with the directive that it's to be used for their career pathway work with their students. So also no limit on that, which is really nice. So to kind of build off of that high school connection stuff that we're doing, we have relationships with DPI and the Department of Workforce Development, DWD, because we really wanted to catch those students early. Because let's say they are going to go pursue something in healthcare after high school, they're home during the summer, they're home during winter break, they usually have a job, right? And so that is just an untapped piece of the workforce that we want to make sure we keep in the field throughout their career and throughout their schooling. We're also part of the Wisconsin HOSA program and the Regional Career Pathways program, which is really nice. So our actual CDCP program is a career pathway that students can enroll in through the Regional Career Pathways program. So our first high school that came to us and said, hey, we want to build an entire semester-long class with this material, which it saves a teacher curriculum writing because it exists. It's free. So Augusta High School reached out to us, and they had their students take a semester-long course. They had the course projected on a screen just like this, and each student has their own laptop at the school. So they did the course individually, but they did it collectively together. So they were interacting while they did the course, and each student did their own work on their laptop. And they also included, the students got certified in CPR and first aid through Red Cross. They had local employers in the healthcare field that would hire a CDCP come and talk about the jobs they have available. So again, career pathway work that they were doing, and they actually received $1,250 that we sent just for that first class. And we've had other schools reach out that are starting to do the same thing. So it's a nice way to kind of diversify their own curriculum without the burden being on the educator as well.
Thanks, Casey.
Yeah.
Oh, a question? Yes, sir.
Career path, is that the same thing as DVRC?
No. Yeah, this is a high school program.
Yeah, it's a,
For-
yeah, they bring in,
DVR has the same name.
oh, interesting. Okay,
That is interesting.
yeah.
They have their DVR training plan, then they have their path.
Oh, okay.
I think that's a pretty common term when we're talking about laddering up and moving forward in your career. So, but this is a separate program related to the high schools.
But it's a good point, though. We are trying to get into more of the DVR and DWD to make sure that if there's people that would be interested in this kind of career, to get connected to them as well. So the other thing is that, we found through research a lot that, individuals want to be trained by someone that maybe has a native language of their own. And there's research that shows that there's higher trust, they have higher quality of care. And we also want to help support language access. So people with limited English proficiency, we wanted to be able to create a whole entire experience in that language. So like Casey said, last year in July was when we launched the program. So it took us a little while to get going, but in March of this year, we launched our Spanish curriculum and total experience. So we have, let me just finish this thought, and then I'll ask you a question. And then, so we have a web page that's in Spanish. We have marketing that is in Spanish. And then the whole curriculum and the tests that the individual takes is in Spanish. And then also Green Bay does communication back and forth. That's also in Spanish as well. So and then we can track the individuals that are coming through that program that are taking that, the same curriculum in Spanish. Ma'am, you had a question about that?
You're working with DVR. Have you started working with REACH as well?
Reach, we have not.
I know that they do a lot of stuff with the Career Development Center and DVR for the special needs individuals.
Okay.
Great,
Okay,
that's
thanks
a great connection.
appreciate that.
I'm gonna write it down, actually.
So that happened in March of 2024, and then, so the second most highest non-English language in Wisconsin is Hmong. So we are launching that in November, so just around the corner, and we'll have a similar experience with a web page, the curriculum, the test, and all of that, and some marketing as well. And then we are working with some of the state refugee resettlement organizations, for new Americans that are coming to the United States to help support those individuals as well. So that organization has a lot of funding for translation services. So we're trying to see if that would be another area to tap into for caregivers, because what we're finding is many people that are coming to the United States, they go into like manufacturing because of the language barrier. And if we can get them into healthcare, because we're kind of knocking down that barrier, that could then lead to a career in healthcare for those individuals.
Yes, and before I go into you can go to the next slide, but just to kind of build off of the language access. So what's really nice about that learning management system, Canvas, every single button is changed to the language in question. So you're not clicking through English language buttons and then hearing your curriculum in Spanish or Hmong. Everything from our registration page, marketing, web pages, and every single piece of that course are in their native language, which is really nice. So this is actually probably one of my favorite parts of the program. So when we first began developing the Certified Direct Care Professional certification, we knew that we can't meet everything that a person needs to know in these positions, right? There are too many variables, too many diverse types of people they're going to be caring for with diverse needs. So our 30-hour training is kind of designed as a more universal starting point. So it's that 30 hours to get you started on a lot of topics, 14 different competency areas that we identified through all of those different means that we knew were important for a very, for the baseline of a successful and competent caregiver. And so the micro-credentialing program grew out of the understanding, one, of people wanting more training, caregivers saying, what else can I take? I want more training. What else do you have available to us? And knowing that specialized populations and needs and all of that need a targeted education piece. They need targeted training. So whether that is someone working with people with dementia, we're currently working on a dual diagnosis, mental health and intellectual disability training. So if you are working specifically with people that have a dual diagnosis that way, you can take this micro-credential on top of your CDCP training to really get a more focused skill. We have respite care, we have the possibilities, this is why I'm so excited, are truly endless. I have had parents and other caregivers talk about needing specialized training for seizure disorders, for AODA issues, for autism spectrum disorder, TBIs and traumatic brain injuries and spinal cord injuries. They're all such diverse needs, and there's already training out there that we can leverage. So we can either have training partners connect with us and fill out an application to be a micro-credential through us, or where we're seeing gaps, like with the mental health and IDD training, we can write it ourselves because we're a university and we have the ability to do the curriculum writing. So along with the badges that they get for completing the Certified Direct Care Professional program, for each micro-credential course that they complete, they also get a badge for those. And on our public registry, each of these things that they have a badge in and have completed and are certified in are listed. So someone could have taken a ton of courses, and that includes any of the CBRF courses they may have taken through UW Green Bay as well. So there are a lot of different things that are going to be able to show up on someone's things, and there's an endless amount of badges that we are able to give. So if you are someone who offers a training program, or you have a specialized training skill that you think it would be really valuable for us to offer, please connect with us. Our contact information is there. If something exists, we will reach out to those training programs and ask if they're interested in partnering with us. If it doesn't exist, we can explore potentially writing it ourselves if the need is great enough, and we're able to do that within our scope of service. So the micro-credentials are also one of the ways that people can recertify. So if they take 12 hours of micro-credential courses over those 3 years, that will automatically recertify their CDCP. So we also have the option to verify your work hours in the time frame and verify that you've worked a certain number of hours in 3 years. And then we're going to work on essentially a recertification course that's going to be shorter than the original, but we'll still kind of go over those overarching 14 competencies to kind of just brush up their skills if they choose to do it that way. So those are going to be kind of our 3 options to recertify. Yes, so if you've been working after you've completed the course and it's time to recertify, we're actually just developing a system that will automatically allow for us to send out the information to your employer, and they can respond to us and say, yep, he's worked X number of hours in the past, 36 months. It would go to Mark, because Mark is the person you're caring for.
Even though he's doing agency.
Yep. Yep.
And then he doesn't have to do anything additional.
No.
It's just, if you have work experience during those 3 years, you are automatically recertified.
Oh, well, it can go to the agency if you prefer. I mean, it can
Yeah.
go wherever you'd like it to. Yeah.
Yeah,
It would be a conflict of interest for it to go to me, I help.
Right.
right, okay. All right, so the next part is our, our recruitment and marketing campaign. So we have a website that kind of so we're doing a lot of marketing. So we're doing newspapers, TV, radio, a lot of social media. We're finding social media is really our best results. And people will see our commercials, and it'll be, hopefully they'll say, yes, I want to become a caregiver, and they click on our website, and it's really simple. On the top right, it says, start your new career today. You click on that, you put some information in, and that gets you started as a caregiver. So, so we're doing all kinds of different things, and we continue to get information out into the public to get more and more people. And we get a report every week. Green Bay submits a report. We're seeing new people coming on, signing up to become a caregiver every day. And we're going to show you some statistics at the end here. So I want to share with you one of our English versions, and then I'll share it in Spanish. So this is what you might see in social media or on TV. Oh, this is going to be a problem. Let's see. Because I'm not in slideshow.
Yeah, if you scroll over to the actual slide up here, I can help you. So scroll onto the actual slide in the middle, and then there's that play
There it
button
is.
right there
Okay,
for you.
thank you.
¿Está preparado para empezar una carrera significativa en la atención médica? ¿Busca un trabajo que se adapte al equilibrio que busca entre su vida y el trabajo? Conviértase en Certified Direct Care Professional hoy mismo y ayude a quienes más lo necesitan en su comunidad. Caregiver Careers le ofrece capacitaciones gratuitas en línea y un bono de $500. Vea su nombre en el Wisconsin CDCP Registry. Empiece su carrera hoy mismo en caregiverscdsp.com.
That one's in Spanish, and then this is the English version.
People across Wisconsin are enjoying the rewards, stability, and flexibility of a career in healthcare. Why not you? WIS Caregiver Careers can get you started as a certified direct care professional. You'll learn the skills you need to make life better for older adults or people with a disability. All training is free and online, plus earn $500 in bonuses. Start your new career. Sign up today at wiscaregivercdcp.com.
And if you've never seen those before, now that you've seen them, it's like if you buy a red car and you see the same red car, that Bader-Meinhof thing, you're gonna start to recognize those now. That's usually what ends up happening.
So,
Yeah, let me talk about this.
Go
Yeah.
ahead, this is,
Yeah.
so make sure, this
So
is last year.
This is our last year numbers this is from September of 2023. So this is what we call our pipeline. This is a live, moving, evolving system of numbers. So as of September of last year, we had about 2,400 students who had just done the first step to say, I'm interested, and filled out the registration form. So that was September of last year. Then we had about 1,261 who took the next step and signed up in their learning management system, Canvas, to start the course. We had about 722 people at this time that had done at least one of their modules. We had 44 people that had done the whole course and were waiting to take their test. We had 37 people who were done with the course and had been certified, and 16 of those 37 had verified their employment. And obviously at that point, we were just a couple months old, so nobody had received a 6-month retention bonus. So what's exciting is where we are a year later.
Yes.
Yeah, so this is as of October 10th of this year. So we have 9,594 people that have filled out the registration form. And one of the things that we ask on that registration form is, are you currently working as a caregiver? And it is about 51-49 as far as the percentage of people that are employed. So we know that there are a tremendous amount of these 95, almost 9,600 people that don't yet have a job. And so those are the people we need to be focusing on, right? Of those, 6,600 have set up their Canvas account and gotten into that learning management system. 3,600 have done at least one of their modules. We have 235 people waiting to take their test. And we have 651 certified CDCPs at this time. Of those, 471 have verified their employment, may more be employed, but have not verified yet. And 230 people have already received their 6-month retention. And so if you look at these numbers, one of the things that we're going to do in this upcoming phase of our project is figure out what happened between 9,600, 6,600, and 3,700. Where are people getting lost in the mix? So we're actually hiring a full position that's going to be a student success outreach engagement person who's going to be able to say, because we have all the demographic data for people, what are the barriers? What happened? Did something happen, in your life that you had to stop? Are you interested? Did you forget about it? Did you sign up? You got the email, life got busy as it does, and you forgot to go back in. You didn't know how to maybe it's a technology issue. So we want to really do some heavy personalized touches with the people in this pipeline to help them get through, because we know there's 49% of them don't yet, or at least at that point, didn't have a job. And they want to become a caregiver, or were at least interested in taking the training to pursue it. So those numbers are very exciting for us. We're really looking forward to seeing where that data takes us as we try to pull people out of that pipeline. So on the employer side of things, this again is September of last year. We had 425 employers that had filled out the initial registration form, and 120 of them had taken that next step to register their WISC Caregiver Connections Powered by Handshake account. Some of them may have already had one, so that saves them some time. But of those that signed up, there were 120 that actually started engaging in there.
Yeah, and these include people who are self-directing their care.
Yep,
So those-
IRIS employers, IRIS participants, as well as family care SDS participants who might be self-directing, and CLTS families as well. So this is as of just a couple weeks ago. So right now we have 1,143 employers, so that jumped from that 425 in a year, and 324 of them are in Handshake. It's interesting that it seems much easier for us to engage our students than our employers in that piece. So if anyone has any information or advice on that, I'm open to hearing how I can improve that. But we know that the more interaction you do in that job matching system, the more success you have in finding employees. And so that is, again, employers include IRIS participants for our program, family care self-directed service members, CLTS members, and then also agency or facility employers as well. Do you want, what are we at for time? Do you want to take any questions?
Yeah, let's do questions, and I'll kind of gear up some websites.
Tell me, Yeah, we're going to do questions first.
So the referral
Yes.
Is there like a type in the person who's referring you name?
Yes, so on.
Automatically link, because if your name is Catherine, but maybe somebody knows you as Katie or Lynn or whatever, is there a way to match, or do you have to to know that exact name?
Well, you don't have to know the exact name. If there's missing information at UW Green Bay, when I say you connect with us, I mean me and my assistant and my administrative professional. Those are the people that you connect with. So we literally verify those. So if there's any missing information, Elise, Adam, or I reach out and say, hey, do you know this person's last name? Do you know their email? Because we can match system information. What's their date of birth? You know, whatever they might know. There's a blank type, yes, and I can show you if we can pull up the application and I can show you, but it is truly, did a CDCP refer you, yes or no? If you hit yes, you can type in their name.
I went through and gave this information to 52, at least 52 families last year. I don't know if any one of them actually completed, but I think the referral thing could
Yeah.
you know, if mom did it,
Yep.
but there's a half a dozen other workers.
Yep, and they put mom down. Mom
Yeah,
gets
you
the
know what I
250.
mean?
That's what
So-
I've been saying to people
Yeah.
as they've come up to the table and we've talked about the referral program, is if you really are dedicated to referring people and they are people that are committed to finishing, it's a lot of money. I mean, it is really a nice benefit. So, but yeah, those are great questions. So so if someone doesn't know everything, we will reach out and get clarification.
Great.
Other questions? Yes. So we have a Zoom meeting that we set up, so everybody gets a Zoom link and we are in there with you. Everyone is muted so that you're not talking over each other, nobody can hear you. And we are in a Zoom room together, so that is how we proctor online. And again, if students need any sort of accommodation, we have lots of students that are nervous about being in a group and taking a test. Taking a test is scary. You know, whether you are used to it, like I've taken 100 tests, I still get nerves when I have to take a test because being tested is scary. So we have people that ask, can I have a paper version? Because I struggle with Zoom. Can I have my own individual room? Yep. Can I have someone read the questions to me aloud in the room with me? Yep. Camera's on, good. We can kind of protect the integrity. So there's been a lot of different ways that they've been accommodated.
Like in, let's say, student accommodation services, they allow like 150% of
Yeah, people can remove the time limit as well.
what that is in this.
We have a 2-hour time limit that we've just set because that's what we've seen. People usually finish in about 90 minutes. And so it's a 2-hour time limit, but one of the accommodations people can request is to remove that time limit. So, yeah, we can just remove it. Or we can, if someone says, can I have 3 hours, we can adjust it either way. So in Canvas, we can extend a time limit as far out or as short or completely remove it altogether.
So we don't need Kurzweil or stuff like that for materials. I use Kurzweil.
No, you shouldn't need it, no. Because it's literally, you just click it's all programmed into Canvas, just like Blackboard.
Now, how does this come into play when you search for a job?
Can you give me more information about what you're asking? Your wheelchair?
Yeah, it's with hesitation to bring it up, but not every client's home is
Accessible, sure.
accessible.
I think as the,
And I don't like to think of my disability and advertise it, but I'm
Yeah.
a realist as well.
absolutely, yeah.
And what's reasonable under ADA and what's reasonable in life are two different.
Sure. I mean, I think that is up to you to disclose any limitations you might have with doing a job or accommodations you might need as the employee. Absolutely not. No, obviously not. You are already doing this as a career, right?
It might lock me out of a client who's upstairs.
Yes, exactly. There might be limitations on who you can serve, but this doesn't prevent you from being able to search for jobs within the program if you want to add additional clients on top of Mark.
I have other soft skills
Yeah,
I can bring to
absolutely.
as a peer with a disability.
Yes, well, as a social worker, soft skills are my bread and butter, so I understand. Yeah, no, those are great questions, though. Yes.
As a parent, I can hire someone who does life skill training. Obviously, you're already caring for your clients' life skills, you'd be able to teach them 10-year-old does. Your chair wouldn't be limiting other than my house absolutely says you can never get in.
Yeah, that's a, Yeah, that's a great point, though. Absolutely.
But we'd be able to take him to the store and teach him how to shop,
Yeah,
so that if he's old enough to shop on his own, he would have that.
yeah,
You'd be able to take him out to the park and go, you have to stay within X amount of space to be safe, because you can still see him even if he's doing it. Your chair can roll up underneath the monkey bar and go, look, you fell, let's try this again. And go back out and, let him do the skip bit. Those are all things that you could do,
yep,
and you don't have to disclose that you're in a chair.
yep. I love that very solution-focused answer that you just gave, and I think that's exactly right. I think that we should always be focusing on what anybody can do and less on what they can't. So I think that's a big part of why we're all here, right? Is because there are far more things any of us can do than we can't.
I only brought it up because
It's a very valid question.
I worked for him in the early lines. DHS brought it up.
Yeah, I think it's a very relevant question.
They were worried, I'm getting help on this.
Sure.
How can you be a caregiver if you need help? It came up.
Yes, well, as we know, having your own disabilities doesn't mean you are incapable of also having a career. So, but I get it. I think it's a very valid question.
Completely incapacitated, but it still continues to come up as a generic question.
Sure, sure. I appreciate you bringing it up. I think it's a valid question.
It's hard to, but you gotta deal with the reality and not leave skeletons in closets.
Yeah.
Because my passion is to care for people wherever I can.
Absolutely.
And not have to always leave skeletons in my closet, same way with DHS does.
Yes.
Whatever.
Yep.
I just, yeah, yes.
Yeah, Stephen Hawking was amazing. Oh, perfect. Kevin's got our website pulled
Yeah,
up, so we'll
I
let
just
him
want
kind
to
of show
quick
a little
show,
bit.
So here's our website, and it's really simple. Sign up here if you want to take this course, and this then takes you to, as Casey talked about, if it's going to take me there. Yep, so it's on your, you should all have one of these
Yep, it's right on the card,
on the card.
WISCaregiverscdcp.com.
Or you can look, or you can do the QR code as well.
Yep.
So this will tell a little bit more about the program, and then apply here. That takes to Green Bay. You just put some demographic information in, and that generates the process where they will then, Green Bay will then contact you and get you started on the process.
Yep.
And I also wanted to show real quick the our Spanish version of this web page. So, oops, went too far.
While Kevin pulls that up, I do have flyers in Spanish. So if you are Spanish speaking, we have them in Spanish and in Hmong. So just stop up and grab them if you'd like them. They also have the QR code and the information on the training. So we have them in English, Spanish, and Hmong up here. Hmong will launch again in November. So not yet available, but it will be shortly.
So this is our, so everything, all the program information, the contact information is all in Spanish. So it's basically the same cdcp.com/es for Espanol. And then this is our Green Bay page. So if you're looking for a someone on the registry, this will come up. And what's our favorite?
SYL.
SYL. Sylvester.
EDA.
EDA. So here's one of our.
I use Sylvester for my example all the time.
So Sylvester took our course. He was one of our first kind of group set individuals. And so he is on our registry. And what's nice about Sylvester is he did his CDCP last August 2023. And you could print a certificate out for him. But he's also had like community-based residential facilities. So for those people that are working there, they're required to take certain training in medication administration, first aid choking, fire safety. So he has all of that, and that is connected to him. So an employer can see all of these different registrations that he has.
And the micro-credential courses that they take will also be listed there. So what's nice about the partnership is that on the CBRF side of things for those trainings, they also partner with UW Green Bay, a different group of my colleagues. So we were able to connect all of that, and you can see all of that training in one spot, which is just nice for everyone involved.
And here's our micro-credential page. So if you're a trainer that wants to partner with us, this is how they would apply. If it's a caregiver that wants to get more upskill their training and get look at micro-credentials, you can go here. These are all the different kinds of micro-credentials that people can get. We're early on. We just launched this, so we only have a
Three
handful.
right now. Three right now that are fully through.
Yep, and we got about another half dozen that are in the process of applying. And so this will grow as we keep going in the program.
Do you want to pull the resources page up too?
Yep.
Because I think that's
Yep.
really helpful.
Are we on until 2:30? So that could always also be a micro-credential at some point, where it's really some of that detailed information. So. Yeah. So who knows? I mean, we're open to anybody that wants to submit some training for us.
One thing that we heard loud and clear, and that was important to DHS and UW Green Bay, was how do we use this training to maximize meeting the most amount of training requirements that the state of Wisconsin might have, right? And so we've been working, thanks to Kevin's diligent work, to get our program approved to meet training requirements for different settings. So that could be the CBRF, again, the continuing education. The state of Wisconsin requires 15 hours of continuing education in certain areas. Our program meets those requirements. We were approved for the 1 and 2 bed adult family homes through the managed care organizations as a training option. And in fact, I'll be writing a supplemental course because I think there's about 4 areas we don't meet in our 30 hours. So I'll be writing a training that will supplement that will meet all of those requirements. So it's one place for those 1 to 2 bed adult family homes to have to come to get that training. And we have these crosswalks that kind of walk us through what are the state statutes, what do the chapters say, and where do we fall into those. So really, we want to keep this available to minimize the amount of effort, time, money, bandwidth that employers, whether you are an individual employer or you're a facility employer, have to put into getting your staff trained. If it can be a one-stop shop connected to DHS that is standardized, that is ideal, right? So that's another thing we've been particularly invested in as we move forward. Yes?
your job or your medical appointments late, like even an hour late, that you're having to share with other people and you not necessarily have the anxiety tolerance to sit next to another cab rider. So having some of the care providers that are doing this be able to transport those clients.
We don't have that currently, but I think that's a great idea to explore. I'd have to figure out, there's liability issues in teaching people how to transport, obviously, when it comes to driving a car. But I think that's the sort of stuff we want to hear. Where are you seeing gaps? And knowing that we need more specialized training for this particular skill that will improve the lives of people that are being cared for. That's what we want. So any of that, there is no bad idea and no wrong door with me or Kevin. We will take all the information and ideas you have, because there's a million ways to make things work. So
another.
Has worked in like 3 different nursing homes and home type places, and each of them had different standard training.
Yep. Yeah.
Having it centralized.
Yes.
Another thing we want to really support are certified direct care professionals, beyond just as a trainer and what we're doing. So we're trying to build resources in this area too. So, if they want to, build their curriculum with badges, continuing education, but also on other things like, you talked about transportation. Well, sometimes just getting to work is a problem for some of our caregivers. So if there are resources out there that maybe there's some funding for or support, we want to have some of that information available, public transport, all of that, healthcare, housing, language assistance. So anything that we can, because sometimes it's complicated. The state system is hard to find resources. So we're trying to bring a lot of that information to and resources available for our certified direct care professionals.
We hear often from people, my caregivers are hired on, but they can't get here. They can't keep coming. And that is often down to things like transportation, childcare, medical emergencies, not having access to their basic needs being met. And so that's how we get them to be able to successfully show up to work, is if their own basic needs are met first. So that's something we both feel very strongly about too. Yes, go ahead. Oh, maybe. I don't know. Is that?
So, yeah, I mean, that is an area that we're hoping, the work that we're doing with refugee agencies, because they have a lot of federal money for language services, that maybe we don't have the funding for translation. But if they can help fund it, UWGB has this system in place now to make some of those curriculum in other languages. So it's definitely an option.
That one we talked about with the refugee.
Yeah, and then here, I just want to show you too, on our website, the site for agency and provider, and that would also include a person who is self-directing their care, who's the employer. So here's where those individuals would go to register for when Casey talked about the other side of the pipeline for those employers. This is the place where they do that, so it talks a little bit about this program and how it's all free, the platform, all the things that it can do, and then it's just joined as an agency. And this is where a person kind of identifies who they are. Are they a provider? Are they a person who is an employer who self-directs? And they would put that information in here. So that, I think it's, yeah. And then if they're connected to a managed care organization or IRIS, this is where that would be put in as well.
It's a real easy way for us to verify that employees of this particular employer are eligible for that bonus because they're serving those HCBS members. So we gather that. That's the reason that we gather that information and vet it to make sure that the bonuses are going to the right place.
Yeah, and then the sign up here, when people sign up for the program as a CDCP, we had a question about how do you find out, so here's where you pick the language. So if it's English or Spanish right now, next month there'll be another option that says Hmong. Yep. Maybe someday we have Russian. So yeah. So that's where that happens. And then they have to agree that they're from Wisconsin or a Wisconsin resident, because we're not training people from Illinois for free unless
they do try
unless they're working in Wisconsin.
Yes.
We do that. We do have some of those
so people that live in a border state but are working and serving a job in Wisconsin can still take this training. We don't want to close it off to those people that might be in any of those border areas and still work in Wisconsin.
So here's where, did a current CDCP refer you? And that's where if they put this in, it would be yes. They put that name in, that person's email, and that's how, once this person becomes a CDCP, that person gets, the other person gets
if they have
a CDCP, if known. Otherwise, we'll find them because they're in our system too.
Yeah,
so.
And we pay out, we send information to DHS on those bonuses on the 15th and the 30th of each month. So it's continuously sent out twice a month so that payments are going out monthly in those two different cycles.
And then here's that question, if, they might not be in our system, but if they're caring for a friend or family member, we still want you to get that for free. But here it talks about are they part of one of these programs? And if it says yes, then it's okay. That person would be eligible for the bonus. If they say no, they could still take that training.
Yeah, and the no pops up a disclaimer that explains, you are eligible to take the free training, but the incentives are not available because of that lack of connection. But kind of just a fun tidbit I learned by helping someone that had reached out early in the program. So it was someone whose spouse had long-term care insurance, no connection to any Medicaid programs, and their long-term care insurance was willing to pay for the caregivers, reimburse her if they were certified. And so I was able to verify for that long-term care insurance company that this is connected to the Department of Health Services through the state of Wisconsin. And so her caregivers took it for free. They didn't get the bonuses through us, but the long-term care insurance reimbursed the person for the care. So just like different ways again, which is why I think it's so important not to close off access to caregiver training. Yes.
I know of a gentleman who works for an agency and has multiple clients, and then has a couple of private pay inclusive folks that if their inclusive pays or
Yep.
their IRS pays or whatever that isn't through that agency. If he gets a bonus through the agency, he's obviously going to be the one. And he's there with the inclusive or the IRS folks for longer than 6 months. Does he get a separate bonus for that?
No, nope, it's 500 total, so he would choose which employer he would like us to verify, if there's one he knows he's gonna be with for certain. But that's a great question. So yeah, it's just the one individual employer that you can tie to. And we do have people that work with multiple different places where they would qualify at each of those places if they wanted to switch, but they only get that individual bonus, that one employer. Are we time off?
Yeah, so we just got like a minute or two left.
Oh,
So,
okay.
Any other questions? So for those that had never heard of this before.
One more, Kevin.
Okay.
Sorry.
Go ahead.
No.
So thank you guys for creating this, and I love that you guys are continuing to develop this, first of all. My question was whether there's been any consideration long-term into looking into in-person training specifically for like hands-on personal care kinds of training.
Yeah, I think that's a great place for the micro-credential to come into it. I think we're geared nicely to accommodate that. So a micro-credential could be in person, or it could be online course. And I think if we found that there's really this need for something that was very skill specific that you'd almost want to have in person, again, we could either create it as a micro-credential, somebody else could do it, and we could link to it. It could be, in the future, now that we have this set up, we could require like managed care organizations to make sure that their provider network has this training, and maybe these, if they take a person with this disability, that they also have this micro-credential. I think there's just so much we can do now with, being creative, and we have a system now. It's we can validate that this person actually took the training and they're certified. So lots I think that we can kind of look at and be innovative. And if you have ideas,
Send them our way.
send them our way.
You'll have access to our personal email addresses through the slides. So yeah, one more
Yes.
question. Yeah, that would be a great connection. That's a great one.
Yep. Right.
That's a wonderful idea.
Yes.
That's what we're looking for, is those ideas. So please send them. Like Kevin and I are pie in the sky thinkers.
Yeah.
We are not afraid of any ideas. So you're never going to catch us off guard with that. So you want to ask your last
Yeah,
question?
so it's my last question, those that hadn't heard about us before, do you know about us now? And will you, if you're an employer or you know somebody that is, will you take action and let that person know, or sign up if you can?
Show of
Yeah,
hands.
show of hands. All right, very good.
I love it.
All right.
Thank you so much. Thank you guys so much.
Code is CARE.
Care. Yep.
Here.
Thank you
Okay.
for your time, you guys.
Yeah,
We
thanks so much for
appreciate
coming.
it so much.